sugar boards highlighting the hidden fat and sugar content in everyday snacks such as pakoras, samosas and vada pav. These warnings will highlight the hidden enemies in these snacks closely linked with obesity and lifestyle diseases. India is staring at a ticking time bomb, which is over 44.9 crore Indians are projected to be overweight by 2050. From sweet shops to canteens, the move signals a paradigm shift. India is now treating junk food with the same seriousness once reserved for tobacco. You look at the data and you will be shocked. And on this issue, I will be joined by Dr. Shikha Sharma, founder of One Health, veteran nutritionist, and Dr. Parjeet Kaur, Associate Director, Endocrinology and Diabetes, Medanta Hospital. Let me straight away go to Dr. Shikha Sharma. Madam, do you think it's the right move? Because the Prime Minister had spoken about the oil consumption and said that India needs to reduce the oil consumption. It has jumped from 8.25 kg per capita to 23.5 kg per capita from 2000 to 2025. Do you think that this is going to resolve the issue?
I definitely welcome this move, and why is it important is because I personally believe after the pandemic our bodies are not the same. There is a permanent inflammation which has come into each and everybody's bodies, which we see in clinically in the raised ESR, in the raised CD active proteins, which is becoming very common. We also see that people are getting fatty liver far more than they were getting. Initially the fatty livers were more alcoholic predominant, but today the fatty liver is because of inflammation. And what is this cause of inflammation? It's the kind of food which we are having. Now, if you really see the jalebis and the samosas, they are being made with reused oil. That means the oil is used once for frying and then again it is used for frying. So all these creates carcinogens. This creates compounds which damage the liver, cause inflammation. So if you look at the rising number of diabetics in our country, if you look at the speed at which cancer is rising in the country, it's all connected to food, environment. Okay. So food is something which is in our hands. So I welcome the move that the government is taking a keen interest in it, in its public welfare, and definitely we need to have some control systems if we really want to keep our people healthy.
Okay, let me take opening comments from Dr. Parjeet Kaur. Madam, do you think it's the move in the right direction?
Yes, definitely. I believe this is a very important, vital step taken by the Health Ministry. Much needed, much awaited step, because I think people are already aware that these foods are unhealthy, but unless it comes out from the Health Ministry, unless this is taken up by the whole community together, this is not going to change. So coming by the Health Ministry, all community involved in this for making this change will make a big difference. And definitely we know that these food items are connected to the rising obesity, rising diabetes, cardiovascular diseases and liver problems ahead. So I definitely welcome this move.
Okay, and Dr. Ananya Avasthi, founder and director, Anuvad Solutions, join me. Your opening comments, madam.
So I feel that I definitely welcome the move by the Ministry of Health and Family Welfare, that at least today I have received so many calls from my friends and family who are finally recognizing that yes, your samosa and your jalebi is unhealthy. And so there are questions, leading to, okay, what are junk foods? What all,
but Dr. Avasthi, life का क्या होगा अगर जिंदगी जलेबी और समोसे से रूठ जाएगी?
Correct. So moderation is the key. आज जितनी बारिश हुई है Delhi में, I was also thinking that, let's have that one samosa today. But the fact of the matter is that people don't really know. I would beg to differ that, and especially in rural areas, it's not even an urban phenomenon. Some of the research that we are doing in UP, you find that children are addicted to biscuits. Children are addicted to even packaged foods like chips and samosas and kachoris without quite realizing how harmful this is for diabetes, fatty liver, hypertension. So the point of the matter is that nothing is banned really, because diet diversity is the rule of nature, but people should be able to make informed choices. You should at least know that your samosa or that kachori which has been fried in the same oil 10 times in a day contains high amount of carcinogens. That can be a game changer.
Dr. Shikha Sharma, is it because of the fact that अगर मैं मीट नहीं खा रहा हूँ, अगर मैं एग्स नहीं खा रहा हूँ, अगर मैं फ्राइड पूरी खा रहा हूँ, people think it's still better than the meat, is it because of that we in India has not developed that appreciation of a sort of a better protein rich diet? It's more carbohydrate centric and these are supposed to be easy food, so you don't see them the way they bring calories, one, and secondly you also don't know how many times that oil has been used.
Absolutely, absolutely. If you really see, most of these vendors and many of the street vendors are reusing the oil multiple times, which becomes very, very toxic for the body. It's not that somebody's going to eat that samosa and drop dead, but the chemicals which are going inside, the harmful things that slowly and insidiously damaging the body. And personally, I don't call it food. This is recreation. This is recreational food. Nutrition is something which does good to your body. Like if you're having apple, if you're having a fruit chaat, I would say it is food which is doing good to your body. It's the food, actually the food is what your body is made of. If somebody asks me, what is the raw material by which your body is made, it is food. So I call this recreational food, like alcohol, like other things. So we have to put a difference between recreational food and nutritional food. So I think that yes, people drink, people have alcohol, people have so many other smoking, and they say, oh, we smoke once in a while, what's the harm? It's not going to kill us overnight. But once we understand that the difference between recreational food and nutritional food...
Or madam, is it, Dr. Kaur, I want to hear, is it because of the fact that in our country, motapa and obesity is not considered a disease? Charbi chad gayi, daud lo to charbi utar jayegi. Without, and people are not to be blamed, no, everyone is not a doctor interested in wellness, without understanding that might affect your pancreas, your kidney, there's something called inflammation, the way they may affect your stomach lining, your gut, which is supposed to be your second heart, and then it can cause irreparable damage because ultimately your body will have no insulin equilibrium, and then it's all down south.
Right. I totally agree with you. I think this is the concept which you're saying, that people think obesity is not a disease, has to be changed. In fact, the term has also changed for this, come out to be like adiposity-based chronic disease. So obesity is definitely a chronic disease, and people have to realize that once they're obese, they need to take care of their health to prevent them from getting diabetes, cardiovascular diseases, and the way to obesity is all the lifestyle. It's a diet, exercise, and I think this step which has been taken by Health Ministry will definitely at least give them some awareness. See, mindset takes long time to change, but we have to start and can be inculcated gradually. So being aware of these food items that are not healthy, maybe at least make them cut down their frequency of eating them, if not totally altogether out. Cutting the frequency of eating these items will also help them in a long way.
Absolutely, but Dr. Awasthi, it's sugar and oil which is creating the complication. Both were not available in large quantity 100 years ago. And specifically, if you would have seen in that Hotstar, the Brown Heart, the documentary, it complicates the situation more for us because genetically we are more predisposed towards having heart diseases earlier than the Europeans. So, what is your advice? How should sugar, fat, and oil be reduced in our diets?
Right. So I'm a public health researcher, so I'll give some idea of the science behind it. When we say junk foods, we essentially mean HFSS foods, foods high in fat, salt, and sugar, right? So and FSSAI has been working towards limiting the consumption of HFSS foods, and these junk foods come in two categories. One is, sort of unregulated market where you're getting your samosa, vada pav by small vendors across the markets. The second is all these packaged chips and cold drinks and even burgers that you get at big multinational, FMCG run restaurants. The question is, as a child, we have grown up aspiring to have that burger, say at an internationally acclaimed chain. When we are growing up, our favorite actors were talking about Thanda Matlab, and similarly you would have the cricket team endorsing soft drinks. Now what has happened is all the junk foods, whether it's packaged or whether it is not packaged, like the advisory that we see today that the Ministry of Health has come out with, what has happened is it is linked with a certain aspiration of good food food, of rich food, of luxurious food, whereas in fact our own traditional diets, right? Pehle, when we were growing up, so Dadi Nani used to eat those moti roti, ya bajre ki roti, right? And now with the, I guess something has to do with the Indian cuisine also.
Doctor Avasthi, I understand. I think I understand what you said. Ghar ka khana khaya karo, and I think that's the most beautiful thing, which is there in our society. But the products have actually invaded even our kitchens, in a very insidious way. For example, the way dalda came into the Indian household life, saying that it's the thing, but ultimately, we all have to talk about ghee and mustard now. Or for example, madam, the way chips and the cookies and the chocolates that have made way as treat foods for the children. I remember I would wait for 2 weeks to get a kheer.
Yes.
But now the gratification is instant. It has become part of your kitchen. And and the kitchen in itself is not that sacred space, and and the kitchen is open all the time. I remember going back to my Nani's place in Agra, and she would say that your lunch is done, and I'm closing the kitchen. So there was nothing to snack for me, So I had to wait till dinner. So, all those things are there, and I'm really sorry. You have 1 minute, madam, then I have to close the conversation.
Yeah. So just I want to add, as a mother of a 2-year-old child, I am very concerned that when I go to a restaurant, kids menu will only offer you burgers and pizzas and fries. And so it's been understood and sold as kids food. And whenever a kid does well in school, it's like chocolate milegi tumhe, chips milega tumhe, ya aaj chalo samosa khate hain, because we are celebrating something. So I think those norms have to change.
Absolutely. And I think more than anything, more people need to be invested in correct sense of wellness. Last time Dr. Shikha Sharma came and spoke on it, but I've really fallen short of time. I thank all of you for joining me, because this is something which is very close to my heart. Me being obese and losing 25 kilos, understanding what obesity can do to you. But I still have one more on point. And the third on point is about, are there unanswered questions in the Air India 171 crash report? Preliminary report on AI 171 has raised more questions than issues it addresses. Many experts are of the view that it gave a clean chit to the manufacturers, almost a clean chit to the manufacturers, and let the blame fall on the pilot's shoulders without giving any detail. And many experts are saying this is not done. Aviation experts say there is much more on the cockpit voice recorder than what has been shared in the report. The Civil Aviation Minister has said that no one should rush to any conclusion. So the issue is, when did the engine stop working and why? Why was emergency locator beacon silent? Was it damaged or not armed? Did engines fail before the timing of the report as RAT got extended immediately after takeoff? Did both switches move on their own? Why does the report not call for inspection across Boeing fleet? Entire episode cannot be judged by a voice quote, is a narrative against pilots being said. Right now what has happened is that the DGCA has actually asked entire Boeing fleet to go for a check. DGCA has done that. Meanwhile, Air India CEO Campbell Wilson, in a letter to his employees, said that the preliminary report on the AI 171 crash had provided greater clarity. He said report found no mechanical or maintenance issue with aircraft or engines. All mandatory maintenance had been completed. No issue with the quality of fuel. No abnormality with the takeoff roll. Pilots had passed the mandatory pre-flying breath analyzer. No observations pertaining to medical status. On this, aviation expert Amit Singh, former Chief of Safety Air Asia and Chief of Training Indigo, raised some pertinent questions over the preliminary report. I spoke to him on this issue. So my first question to you is, are we really asking the correct questions? And what is the moot question, and why are some of the experts, including you, are saying that report has not fulfilled its expectations?
The preliminary report, as per ICAO, the UN body to which India is a signatory, is a very basic and simple report. It should contain whatever information which has been obtained during the course of this 30 days period. So whatever information is there in terms of factual information, the flight data recorder data, the cockpit voice recorder transcript, and any other parts which are available, witness statement available. So all these have to be collated and presented. in the format which is in the final report. So analysis needs to be blamed. So that is what is. And if something important is found during the course of collection of evidence, then recommendations have to be given immediately so that the other fleet which is flying globally can be cautioned.
Okay.
So
you said, let us be clear, no factual basis exists to blame the crew. The available evidence point to more profound, more technical questions than the report avoids addressing. Your comments, sir.
So this report starts off by giving a CVR transcript, a short piece of conversation between the ATC controllers and the pilots, and then moves on to how the takeoff happened, the timing of takeoff, and fuel control switches, which is the point of focus right now, the movement of the fuel control switches off and on, and then further the ram air turbine deployment, the APU flap opening, certain facts have been given and leading to the accident. In between, there is a statement which is not a CVR transcript, does not have a timestamp, but is what an investigator has heard over the CVR. That why did you cut off? And the other person says, I did not. Now, this is kind of leading the whole investigation towards focus on the pilots, away from the technical aspects. And a lot of people are interpreting it as, why did you cut off the fuel? Whereas fuel is not mentioned anywhere. The context is not given, nor is the timestamp. When was this conversation? At what stage of the flight? It could be before start, after start, during taxi, after takeoff. It could be anywhere.